Sure, absolutely. Thank you all for having me. I'm Dr. Amanda Furr. I have been a pediatrician in the Indianapolis or greater Indianapolis area for well over a decade. I serve as the physician executive for primary care for Community Health Network, and that includes our adult care as well as our pediatric care, and overseeing our urgent care, and then also recently our school-based services. So really happy to be here and happy to help to facilitate as best I can, getting some information, answering some questions, and really providing you with the information that we have scientifically and medically to this point. Of course, it's obviously, it's a constantly evolving, ongoing learning opportunity for the entire medical community as well as everybody else involved. So I'm happy to share with you the information we have, and I'll be sure to let you know where there's evidence and where evidence might be lacking and what we're thinking about.
Very good, very good. Dr. Furr, we do have a few questions that we would like to start off with. You know, when COVID-19 first, you know, presented itself back in late February, early March here in the Indiana area, and even nationally, face coverings and masks really were not a part of that conversation or narrative. And we're seeing the opposite of that now. You know, Marion County has a mask mandate as of July 9th. I just saw this morning that Fishers is putting in a mask mandate starting here soon. Why are face coverings and masks now becoming so prevalent in slowing down the spread of COVID-19?
This is a great question, and it really speaks to kind of our evolution and our learning about COVID-19. So first of all, COVID-19 is spread primarily by droplets. So when we sneeze or we cough, or we might touch our face or our mouths and then touch something else, that virus spreads in those droplets. And so one of the best ways we can do to protect ourselves and to protect others from us is to put a barrier between us and them with regard to those droplets and the spread. So the masks are key. Most viruses shed through secretions, and really that comes from saliva in our mouth, nasal drainage, eye drainage. But by covering your nose and mouth, you're not only preventing those droplets or that virus from getting to you, you're preventing anything that you might have or carrying from getting to someone else. So having that double mask between you and another person really dramatically cuts down the spread. We don't know exact numbers yet, but one study that recently came out said that if you had a mask and someone else did, and you were able to stay 6 feet apart, the chances of that virus getting from you to them was about the equivalent of getting struck by lightning. And I like those odds. So I wear my mask, my family wears their mask, and we really try to stay 6 feet away to prevent the droplets from getting from you to them or them to you.
Thank you, thank you. I noticed that you are a member of the American Academy of Pediatrics, and the American Academy of Pediatrics put out a statement that strongly advocated that all policy considerations for schools and districts should start with having the goal be students present in school. Why is the American Academy of Pediatrics coming out with this strong statement of getting kids back in school?
School is such a critical place for children, and I feel like I'm speaking to the choir here, talking to you folks. But there is of the obvious academic benefits of in-person school, but there's also that social need, as well as that need for that safe, consistent home for kids that they may not have in their true home situation. And so I think focusing on getting that for children is always a risk-benefit weighting. And I, again, don't have to tell you guys this, but the American Academy of Pediatrics felt like we we really should prioritize that goal for in-person education as long as we can do it safely. And you will see that caveat throughout. If you go to their website and read through, you will see that caveat that in the context of being able to do it safely, that should be the goal, is to get children back to in-person schooling whenever possible.
This next question kind of ties the first two questions together. So getting our students back into school, you kind of mentioned the physical distancing piece. The American Academy of Pediatrics came out with a physical distancing of 3 feet, of at least 3 feet, which kind of came after the CDC had put out some social distancing, physical distancing guidelines of 6 feet. Can you talk to us a little bit about, why did the American Academy of Pediatrics come out with the 3 feet piece, and why that might differ than the CDC?
Sure. Another great question. So the 6 feet is really considered the most conservative distance, especially if you're unable to be masked for any reason. The American Academy of Pediatrics put the range of 3 to 6 feet based on what we know about other viral shedding and other virus spread. So, for example, there are other viruses that are droplet precautions that we know that really don't go beyond about that 3 feet. RSV being one of them. Others could spread up to 6 feet. So smallpox is one we know that the range is 6 feet. Because COVID is a novel virus, meaning it's a new virus, everyone felt, including the CDC, that the guidelines should be fairly conservative, and so put out the 6 feet. The American Academy of Pediatrics gave the 3 foot range, especially if you can use face covering, as being sufficient. Because again, back to the question earlier, using the face covering, like a mask or a barrier, really prohibits that spread significantly. So in most cases, 3 feet should be sufficient. But the range is really because it's a new virus, and so it's based on what we know about other viruses that we've studied.
Thank you. One of the questions we've received a lot from our teachers is helping them identify COVID-19 symptoms with their students. Do you have any recommendations for our teachers and staff in trying to identify COVID-19 symptoms versus maybe non-COVID-19 symptoms?
Sure, this is difficult. And even as a very seasoned pediatrician, without testing, it's very difficult in children especially to be able to distinguish the thousands of other viruses we all encounter with school-age children every year versus COVID. COVID symptoms tend to be fairly mild in children, and so I think this year is going to be tricky. I mean, being very transparent, it's going to be hard for everybody to sort it out, and I certainly wouldn't feel that teachers should be able to sort that out in a classroom setting. So in this case, the recommendations are that if they have any viral symptoms, that they be evaluated. And the Indiana State Department of Health has put out a nice guide about how and when children should return to school. Should they have symptoms or should they be exposed? And I think they've done a really great job with that. But my advice for this school year is that any viral symptom be treated as if it could potentially be COVID until it's been evaluated by a medical professional.
Okay, thank you. So we've, been in this COVID-19 space for about 4 months, and both from an Indiana perspective and a national perspective. What have we learned about the impact of COVID-19 on school-age children?
Mm-hmm. Yeah, so we're learning more all the time. What was fairly fascinating from a scientific kind of epidemiology standpoint, others might not find it fascinating, but people like me do. It's fascinating that children were not severely impacted. I mean, despite the global pandemic and the numbers, the percentage of children that developed symptoms was always significantly smaller than adults. And we knew that the rate of hospitalization was lower in children. I wouldn't say that we have total answers on that. We have a lot of theories, some of it being that coronavirus, which is the family of viruses that COVID lives under, is fairly common in small children. Other types of coronavirus cause colds, runny nose, sniffles, the common childhood virus. So there's potential they have some cross immunity that us older folks lose as we age. There's also some thought about that something about their cells are different in the way they interact with the virus. But we do know that their symptoms are milder in general, and that their severity of illness, risk of hospitalization, risk of death is lower. Along those lines, one of the follow-up questions I usually get is, well, are they going to spread it around? So kids are kind of known for that, right? Or they're known for spreading the germs around, and they can have mild cases of flu, but spread it like crazy. I think the evidence isn't conclusive, but it is based on studies in other countries and early studies here. They don't seem to spread it. They don't seem to be what we call vectors of the virus in this case, as much as they are for influenza or rhinovirus or other types of viruses that cause the similar symptoms. So that's a really interesting phenomenon. That's a little different than if you would compare it to influenza, for example. It's not that they can't spread it. They certainly can. They certainly can get it, and they can certainly spread it. It just does not seem to be in the same way that older adults and adolescents do.
I have a follow-up question kind of on the spreading of it. I know when back in March, when we first were introduced to COVID-19, we were really responding with the cleaning of high-touch areas. Are we finding that that is still a way that it is spread? Is it more through the droplets that you referenced earlier, or is it a combination of both?
It's a combination of both. I think that we are still learning about how long it lives on surfaces, and it depends on the type of surface as far as the life the virus might have on there. Definitely still recommend cleaning high-touch surfaces very frequently. There is certainly, virus that lives in droplets on, desks, doorknobs, anything that other people might touch frequently. Things outdoors, playgrounds, things like that. There's less evidence that it needs to be disinfected more than just cleaned routinely. And that is one thing that we've focused on even in our own offices, is how we clean those high touch surfaces. So we've definitely stepped that up in our own waiting rooms, in our offices and buildings in general.
I heard you mention the other countries as part of what we're learning. What have we learned from other countries? We've heard that Denmark and Sweden and countries in that area have reopened their schools. I don't know if that information gets to you here, but what have we learned with them reopening their schools?
So there's been varying reports about the impact of kids going back to school. We certainly know the biggest factor in the spread within the school is the spread within the community. So if you look at countries who were fairly successful at the back to school plans, their rate of community spread of the virus was fairly low. And I think that's why, a lot of plans have kind of this built-in flexibility, because we're watching very closely what is happening in the community at large. And a lot of the cities and businesses have gone to the mask policies to help control that. So your rate of spread in a school seems to be very related, and this is somewhat common sense, to the spread that's happening in the community. So I think, you know, schools, businesses, our system, of course, is watching that very closely as a predictor.
Yeah, that makes sense. You know, we've seen, I don't know if it's a second wave or if it's just a resurgence of COVID, both here in Indiana and nationally. Is there any commonalities of why that's happening? Why we're seeing increased cases?
This is of course multifactorial. One is we all came out of quarantine, right? So there was a lot more interaction. Businesses went back to business. Folks are out a little bit more. So just more contact. Like we said, contact is really the close contact is the way this is spread. And so as contact increases, the spread has increased. You also, if you look nationally, Indiana did actually a really phenomenal job early on to close things down and get really the spread under control. Other states, unfortunately, were not able to have that type of success. And again, as people have traveled and interacted more over the summer, it's just kind of natural epidemiology that it starts to spread again.
I have another question, and then we'll see if there's any questions that have been posted. In Warren Township, we serve a diverse community. Can you speak to a little bit of why this is having a disproportionate effect on our families of color?
Yeah, you know, early on we had conversations about this. I think some of it was nationally in the messaging that happened. It did seem to be portrayed as only affecting certain races or certain groups of people, that it really, within especially our minority communities, it was not seen as a virus that impacted those communities. And so unfortunately, I think that we were a little slow to provide the proper education. Also, many of the minorities live in denser populated areas, and those are of course naturally impacted by just the close proximity to which everybody lives. I also, you know, also in many communities, unfortunately, the Black population has a disproportionately higher number of chronic illnesses and diseases. And we know that age and chronic illness are two major risk factors for severity of COVID illness.
Yeah, that's
so something we're watching closely.
Yeah, thank you. It's interesting about the messaging piece now that I reflect on that. That is the way that happened. Well, thank you. Those are the questions that we initially had. Ryan, are there any other questions that you'd like to present?
Yeah, I think there's several that come in. I'm trying to group them into the ones the most frequently asked. Dr. Furr, we have committed to providing all of our staff both face shields and face cover or cloth face mask. There seems to be some questions about are face shields just as effective as cloth masks? Should we wear them in combination? Or is one just as effective as the others? Can you comment on that?
Sure. The best thing is the combination of the two. As I mentioned earlier, most droplets in normal interaction are going to come from either secretions from your mouth, your nose, or your eyes. And conversely, the way virus can get into your system from normal contact would be contact with droplets in through your mouth, your nose, or your eyes, which is why from the beginning we've said don't touch your face, wash your hands, avoid that cross contact. So a face shield is really designed to protect all, including the eyes, and then the mask would be additional protection. So for example, in our offices, if we see patients who are presumed to have it or are symptomatic, we really require that all our providers wear both a mask and a face shield. In the case that you could not wear a mask or the patient could not wear a mask, I'm speaking in our terms, but in your terms, in case somebody could not wear a mask or a mask was prohibited, hearing impaired children, or someone who needs to see your facial expression. Some of our developmentally delayed or autistic children may not respond well to the mask. Certainly a face shield is the better option so that they can see your entire face. But the best protection would be the combo of the two if possible.
Thank you. One more, just any general recommendations that you would make to teachers about how they minimize their risk? I know several had mentioned that they need to take several precautions with what they do with their clothing at the end of the day, or what they just to what steps they should take to protect themselves and their families. General recommendations that we have received, have to do with social distancing, good hygiene, wash your hands, and wear a mask. Is there anything in addition to that that you would recommend to a teacher to do as a precaution that they can do on their own?
Sure. I absolutely can't say enough about the washing the hands, cleaning the high contact surfaces, the barriers when you have to be within that 3 to 6 foot range of someone else. Those are all absolutely critical to preventing the spread. As far as the clothing goes, most contact, unless you've had direct, and I work with children, so I know sometimes direct contact with fluids just happens. But unless you've had direct contact, your clothing is probably okay. You don't need to come home and burn it or do anything crazy. Now, when I come home from my office, I will tell you personally, I do change my clothing. I wash it. I don't do anything special. I just wash it in the washing machine with everything else. But I change my clothing. And I've always done that, even pre-COVID, because I see children with viruses all day. And so I change it. I have 4 children of my own and a husband. But other than that, no, I think it's just being very diligent. It's being very diligent about not touching your face, about washing your hands frequently. We've all taken care of children for our careers, right? And we know the kind of germs and viruses they spread. And so for many of us, this is normal practice. It's just more about being very diligent this year.
Would you agree or comment on several I clued in when we talked about students of certain ages maybe not being vectors of this virus? It seems to be around that 10-year-old age is what a lot of people are referring to. Would you agree that regardless of what age of student you teach, whether that be a 17-year-old student or a 6-year-old student, that those universal precautions are just as important as effective regardless of the age of the child you teach?
Yes. I think the positive is, although we're not entirely sure, 10 and up, that they aren't quite the vectors as the little ones. The little ones don't seem to be, but the older kids do have the ability to social distance a little bit better. The little ones just really don't have that concept of personal space yet, and they really need that more close contact for their learning. But the older ones, we should just continue to social distance, maintain that good hand hygiene in order to prevent the spread. In taking precautions, we really can not eliminate, but we can very much reduce and minimize the risk, as long as we take those straightforward, simple precautions.
All right. Thank you.
Dr. Furr and Steve, we greatly appreciate our partnership with community. We know your time is busy as well, and we appreciate you carving out this time to speak with us here in Warren. Dr. Furr, I want to make sure that I don't give you the opportunity. I want to make sure I give you the opportunity to share anything else that maybe we didn't ask. And if you did, just thank you for being a part of our webinar today.
Sure. I mean, thank you very much. And so much admiration for teachers in the school systems. I want to acknowledge that this is difficult. So as a healthcare leader, I've been trying to navigate those that I serve for the past several months, and the anxiety is real and the unknown is real. I do believe that we're learning more every day, and we now have very solid evidence to support the precautions that we've talked about today, and that they are effective. They don't eliminate all risk, but I mean, there's very few things that could, but they certainly do minimize it significantly in helping to protect you and the children. We're here to be your healthcare partners. I'm happy to come back and talk at any point or answer questions as you guys see fit. But I will acknowledge that I understand the anxiety and the uncertainty, and I think we all in healthcare are learning to move forward with the information that comes out and making the best decision with what we know at the time.
Well, again, thank you so much. You are welcome to stay on the webinar with us as we go through our learning models. But again, I understand your time is very valuable and you're busy. So if you need to leave there as well, we understand. So thank you again.
Thank you all. Have a wonderful day.
Thank you, Steve. As Dr. Furr mentioned, if you have additional questions that you'd like us to have her respond to, you can send those to us, and we'll continue to learn more about this and best provide a safe environment for students and staff. If you were a part of last week's webinar, I shared with you that we created our safe reopening plan around 4 pillars: safety and students of our staff, academics, athletics, and extracurriculars, facilities and operations, and equitable access and outcomes. All of those can be found in our safe reopening plan, which was emailed to our staff and is available on our website. What I would like to do for the rest of our webinar today is go into a little deeper dive of our learning models, teaching learning models. As you know, we've delayed our start date to August 6th. I will share with you, watching what other Marion County districts have done to delay their starts. We are going to continue to monitor our data here in Marion County. We're going to continue to have conversations with the Marion County Health Department and the other school districts. And we recognize that August 6th for right now is our start date, but that could change with new information. Our current model right now for kindergarten and 5th is a 5-day in-person model and with a 5-day virtual option. And for 6-12, we are incorporating a alternating day model with a black and gold schedule. And our families will also have a 5-day virtual option at that level as well. So at this time, I'm going to ask Ryan to share with us a little bit more about the in-person model and what information we have today.
Sure. Thank you, Dr. Hansen. One of the most frequently asked questions that I've received over the past week as we communicated the learning models were exactly what would class sizes look like. That's a particularly challenging question to answer just with consistent enrollment. And as many of you know, yesterday was our last day for our families to indicate that they would be choosing the virtual option. So now that virtual registration is cut off, or we're now adding students to a wait list if they indicate for that, we start to get our first glimpse of exactly what class sizes are looking like at the K-5 level. And I've broken it up by K-5 just because this is a 5-day model, meaning these students will be in class every day. So we're really being intentional about looking about the number of sections we have in each grade level spread out amongst the 9 K-4 schools and the 3 intermediate middle schools. And with our virtual enrollment, which I know Mrs. Griffin will talk about here in a little bit, and the number of sections that we have dedicated towards kindergarten through 5th grade, based on our virtual and in-person enrollment as of this morning, you can see the average class size amongst each grade. So kindergarten, where we're standing now with an average class size of 11, 16 in 1st grade, 17 throughout 4th grade, 2nd to 4th grade, and then currently 19 at 5th grade. I'm currently looking at all sections and additional opportunities to see how we could make these even better in some cases, but keep in mind that we continue to enroll students every day as they show up, right? We're a public school system. We don't deny students enrollment as they come in for that. But I'm happy to announce that based on the number of allocations we made for teachers in K through 5, that we have the ability to keep those class sizes at much more manageable levels with more appropriate social distancing. And just to piggyback off the communication about our requirements for face coverings for students as well. With the addition of the spacing that we can achieve and with the face coverings being required, we feel really confident that we're providing a very good teacher to student ratio amongst these class breakups, given the reality that we're currently facing. These will be continued to be updated, and we're anticipating having final staffing allocations done shortly within the next few days. So class list and rosters can be provided to teachers so they can take a look at exactly what their particular schedule looks like or their particular caseload looks like for those students. Now, when we look at students in grades 6 through 12, obviously we have an added advantage of being on a black schedule or a gold schedule. So with those class sizes, once you take virtual off the top, which as a district, we have just over 30% of our students choosing the virtual option. And then you take 50% off that as well in terms of having no more than 50% of students in the building on any one given day. Our class sizes are looking extremely healthy on the low end, I mean healthy, on the 6th through 12th grade. Obviously, there are hundreds, actually thousands of sections when you look at 6th through 12th grade scheduling. So it's not appropriate to give an actual average size, but in most cases, we're at 15 or below in those classes. Of course, we have some unique classes, but at this point, even with some planning for additional enrollment, it's fairly easy to say that we're confident that class sizes will remain in the teens as we move forward. Again, we'll adjust those, and we're working hard to make sure that every day we're making adjustments if need be, and we're monitoring to make sure that there's no unique situations that we need to look out for. But we're really excited to be able to reduce the number of students in classrooms, be able to provide for more space, and then ultimately be able to provide those students ultimately more attention they need towards academics and everything else that we have. I do want to go, Dr. Hanson, you can go back to that alternating day calendar. You'll find this within the school reopening plan as well, but the black schedule and the gold schedule is initially released in there for the first semester. If you notice that, alternating day is exactly what we mean in terms of alternating day with what that schedule and how that plays out for the first semester. Your building principals / department chairs and everyone will have a lot more conversation about the specifics of that. If you can move forward now, Dr. Hanson, one more. But just a little bit more specifically, and I know we touched on this on the last webinar, we really have the baseline foundation of an alternating day schedule from an instructional lens looking like a direct instruction day and then an application day. All students or all teachers report to work every day, but only half the students on the black schedule will report on one day, while the students on the gold schedule will report the following day, and students on the black schedule will be in their virtual day or their application day. So the language that we are using and will continue to use is the in-person day of instruction the in-person day where students receive direct instruction from the teacher is our direct instruction day. We utilize those class periods to deliver critical content, to provide that direct instruction for students to be able to get that directly from their teacher. On their virtual day, where they're not in person at school, that is designated with students will apply their learning from the previous day of a direct instruction. There have been a significant amount of questions about will I be responsible for teaching both virtually and in person on alternating days? Your caseload will remain normal from what you're used to in previous years, but you'll be required to provide direct instruction for one group of students while the other group of students is participating in their application day. Now, we would expect you to communicate with all students. If a student on an application day has a question, just the same way they may email you before, we would want you to be responsive to that. But the application day, the virtual aspect of the application day does not require a synchronous learning opportunity or any additional teacher meetings amongst that. So we're developing some more specific guidance and support for exactly what that will look like for you to receive in your buildings through, again, your building leaders, your department chairs. But that is the foundation of the alternating day schedule and what it will look like from an instructional point of view.
Thank you, Ryan. And Pam's going to share a little bit with us about our virtual model.
This has been a very important option for our families. And now that enrollment has stabilized, we're in a position where we can begin to staff and make sure that we appropriately schedule all of our families who've requested this option. What I've provided for you is just a breakdown of where we are, the numbers. As Ryan shared, our cutoff has remained, but we did have some families that called our registration hotline before the cutoff, and so we're working to get all of those families taken care of since they met the deadline. As you can see, when you look at the numbers that we have for our families that have expressed their interest, they are very healthy. And so this has put us in a position to design an instructional model to meet the needs of these families while also making sure that in our schools, we're able to socially distance. And so today I wanted to share just a little bit of information on these 4 areas that as we identify our teachers and we place them in schools and we are able to share the expectations of the Learning Academy, we'll be able to see these things with much more clarity. Our virtual instruction is going to come through Canvas for grades K through 12. And our K through 4 students who are used to using Seesaw will still have that as an option with their elementary teachers. Also, because our hope is that for many of these students, they'll return to the classroom, our instructional practices are going to follow our curriculum maps as well as use our foundational curriculum. And so our students will have access not just to the technology, but they'll also have access to the resources that come with their foundational curriculum so that they can apply their skills in the same way our students are applying them in the classroom. Also, we're going to make sure that the same professional development that happens for our staff when it's needed and appropriate is happening for our staff too, as well as meeting the exceptional needs of teachers who work in a virtual environment. But most importantly, it's important to us that our grading practices mirror our campuses so that when our students do transfer back, they have transcripts and grades and skills that are recorded so that the teacher who is receiving them knows where the student was when they left them. Our attendance practices will also follow similar processes to what we have for our in-person, but obviously with the uniqueness of this year, we want to be very intentional about tracking attendance for our alternating day students as well as our virtual students. And so we will be implementing procedures to make sure that when we are taking attendance for students that it is accurate. And we're also going to make sure that we follow our truancy processes. When you run a virtual program, just like our face-to-face program, it's important that we see our kids every day. And so we will be intentional about those processes as well. And lastly, we've had a lot of questions about extracurriculars. And yes, these students can participate in extracurriculars if they're in good standing, just like a student who attends school during the day. We just, unfortunately, in the situation for a student to participate, they have to have, if it's a extracurricular that meets on campus, for example, they have to have transportation to and from those opportunities, and they have to agree to follow the health protocols that we have in place to protect our students who are participating in those activities. Please, you guys know that if you have any questions, you're always welcome to reach out. I'm excited to share this with you as we continue to grow it.
Ryan, are there any questions that we can address on what was just shared?
Um, I'm looking through these. There are a lot of very specific questions towards individual situations. I'm looking for universal ones, if you give me a moment.
You know, I think for our families, it's just going to be important that some of the things that we implemented with Learn at Home and e-learning are not going to be the same. And when Pam mentioned the consistent grading practices, that's going to be a big one that students are going to have to unlearn what took place in March, April, and May, and relearn that the activities and the assignments that are given to them do count towards their grade, do count towards their learning, and that they're going to be held accountable for that. So that's one thing that we'll want to reinforce with our students.
Dr. Hanson, there are some questions specific to what, and this probably for Mrs. Griffin to answer, more specific about how students will be provided elective and related arts classes virtually, just what that plan is specific to. I know it differs upon grade level, but the easy way to answer is students in virtual will be provided opportunities for related arts. Pam, do you want to elaborate on that a little bit for the questions that are coming in about that?
Yes, thank you. As Dr. Hanson shared, we have to make sure that our virtual students launch as successfully as possible. It's very important to us that they know that what they are experiencing in this new model is school. And so, and it's new, and we want to prepare them. And so as we think about electives, as we see them in the realm of 6th through 12th grade, it is our intent to offer electives. What that looks like for scheduling, we are developing that right now. We want to make sure that our students have access to their related arts courses. It's very important. In fact, we know that that's the reason a lot of kids come to school. And so we want to continue to grow our students there. In grades K through 5, we also want to offer related arts. And so as we are thinking about how we want to build that model, we will tap into our related arts teachers to get some feedback from them, create some focus groups so that we can collect that information. Because as we are building the K through 5 model, we want to make sure that our parents can access all of their coursework very effectively, because we've also got to teach them. And so once we are able to efficiently and effectively support our parents and students into accessing all of their core content, then we're going to introduce their electives so that our students can begin participating in those, because we, again, believe that they are very important, and we don't want students to miss out on opportunities to grow in the arts.
Yeah, a good reminder for us in our students and families, it's just not going to be the same. And I think we have to realistically go into this knowing that some of the electives that we offer K-12, it's just going to be a different experience. In some cases, it may be a better experience. In some cases, it may not. And we're going to do everything we can to get students the same experience as they would have had if they were in person. But I want to be realistic too with everyone that it will not look the same in some situations, and we'll do our best, and that's kind of where that will be. So Ryan, any other questions before we move forward?
Yeah, there's a lot of questions about just talking about the second quarter for K-8 as students start the transition, potentially transition back to face-to-face learning. How are we going to ensure that class sizes remain appropriate? Seems to be a key word. Just remember, the way I would answer that is, remember there's a balance to virtual staffing versus in-person staffing. Mrs. Griffin and I have worked hard to make sure that we have appropriate and adequate virtual staffing, and at the same time have enough in-person or face-to-face instruction staffing so we can achieve both. If as we start asking for people's commitments for the second quarter, we may have to adjust staffing to assure that we You know, if we have a significant portion of students coming back to in-person instruction, we will transition some virtual teachers potentially back to the classroom to allow for that, and vice versa. If we have more students who want to go virtual, we could potentially transition some face-to-face instructors to the virtual realm, just to make sure that we're adequately making sure that we're providing teachers with the resources they need to manage their class size. So that is again, for K-8, that's a quarter by quarter determination, and for high school, that's a semester by semester conversation that we're having. But that's how we plan on addressing that.
Any other questions before we move forward?
No, I'll keep collecting and see what else comes up.
Okay. As we ended last week, we'll end with the same guidance and direction for you. If you have questions regarding in-person and alternating days, you can reach out to Ryan with those. If you have questions regarding the virtual option, you can reach out to Pam. Our exceptional learners and whole child, you can reach out to Allison. Anything HR related, Brian, from an operations standpoint, including cleaning and sanitation, you can reach out to David. And technology related, you can reach out to Kent or myself. At this time, I would ask that Rachel provide some closing comments for us as we end today's webinar.
So thank you again, everyone, for attending. We really appreciate your time, especially towards the end of your summer, and your thoughtfulness and the thoughtfulness that are in the questions. As I have said, I think every single time we have had one of these conversations, we are asking for grace and flexibility and a recognition that everything is very fluid. As Dr. Hansen and Ms. Griffin already stated, things are going to look very different this upcoming year. And it's going to be important to temper both your expectations as staff as well as expectations to students, and to make sure that we are not making promises we can't keep and that we are setting appropriate expectations. I know that there is still a lot of fear, and I think Dr. Furr covered that as well. Do know I'm still every day looking at that board. Today was not good. Hopefully tomorrow will be better. Yesterday was better than today. And that is something we track daily, if not more so, to make sure that when we come back, we can come back safely. I know that there are a lot of questions that may not have been answered, and there are a lot of answers that we are still working on that. That is a big part of the reason that the start date was pushed back, as well as getting some time for the mask mandate to work. We want to make sure that when we do start, we are able to start and hit the ground running, to start with our best foot forward, both for our staff and for our students. So please know that that really was one of our kind of fundamental goals in that delay, is not just the safety aspect of it and making sure that the numbers have gone down and community spread has gone down some, but also making sure that we are just ready to start the year with our best foot forward. I have all of the confidence in the world in all of you, but it's going to be a hard year no matter what happens, and I think everyone knows that. So just know that you have an amazing staff that is here to help you and answer questions, and that we are all here in this together as we work towards the start of our school year. So thank you so much.
Thank you, Rachel, team. Thank you, Warren team that attended today. We will post this recording on our website either later this afternoon or first thing in the morning. If we find that new information is needed to share, we will create an additional webinar to get that information to you, or we will funnel that through your principals or supervisors. Thank you again, and have a great afternoon.